Bismillahirrahmanirrahim. Assalamu alaikum and welcome to Tabadlab Live. You usually see Musharraf or Amber here. I'm Umar Nadeem. I'm the head of advisory services at Tabadlab, and I welcome you to this latest episode of Live. We have a very interesting duo of guests with us today. We have Dr. Tareena Musaddiq and Dr. Farah, who have written a fascinating paper, Educate the Girls, Long-Run Effects of Secondary Schooling for Girls in Pakistan. While we'll wait for Farah and Tareena to go into the details of what this paper reveals, we thought this would be a very pertinent topic to discuss in the context of COVID-19, how this has affected education, how this is widening the losses and the gaps that already existed in Pakistan, and hope to get some great insights from Tareena and Farah as we go along. Before we start and jump into the conversation, I'll briefly introduce our two guests today. Dr. Farah Saeed is currently a postdoctoral research fellow at the University of Göttingen. She's a development economist who uses field and lab experiments to work across a range of aspects around poverty and gender in low and middle income countries. She specifically focuses on the effectiveness of secondary schooling in improving welfare of students, how to motivate female labor force participation, and behavioral biases around credit and savings. Our second guest today, Dr. Tareena Musaddiq. She's also a postdoctoral research fellow at the University of Michigan, Ford School of Public Policy, and she has research interests in education, health, and development economics. Thank you, Farah and Tareena, for joining us today and taking the time to discuss this fascinating and really interesting paper. We'll jump right in, and Tareena, if I can start with you, what motivated you to understand this particular aspect of education in terms of how girls and secondary schooling can actually improve outcomes in the long run? So a little more context for our viewers and listeners on what the paper is about, what informed and sort of motivated the study, a little more about the program and the context in which this was evaluated, and what the findings are.
Thanks, Umar, and thank you for having us today. Let me begin by just giving some statistics on what the state of education is in Pakistan, and in particular, what it looks like for girls. So Pakistan is only one of three countries in the world where more than 1 million adolescent girls are out of school. So this is specifically for adolescent girls. But if we look at the overall numbers, Pakistan has 23 million children who are out of school, which means they're in the school going age, but they're not going to school, which places us only second to Nigeria in the absolute number of kids who are out of school. If you look at enrollment rates, you can see that gross enrollment rates for primary school are much higher. So we are achieving around 100% enrollment there. But for secondary schooling, the rates are low. Particularly, we see a strong decline as we move from primary to secondary enrollment rates. And in both primary and secondary school, girls lag behind boys. For secondary schooling particularly, we see below 40% enrollment rates for girls. And even that 40%, I would say, largely comes from lower secondary grades like 6 through 8. If you look at enrollment rates in grades 9 to 10, it's around 25%, which means that very few girls are actually making it till completion of secondary school. So these are some numbers that I've given to you around the state of education in Pakistan, and I think we all know that we have a crisis in education. But what about health? Because a lot of the outcomes that we look at relate to maternal health and child health. So let me give you a few numbers on that end as well. Pakistan's maternal mortality rate is 251 per 100,000 live births, which means when out of 100,000 women that give birth, 250 from every 100,000, 251 die because of childbirth reasons. And to put some context to that number, this is higher than other South Asian countries, but compared to the developed world, the number is at 18. So we have 251 per 100,000 live births, and for developed countries, it's only 18. Why do we have such high numbers? There are a number of reasons for that. First is maternal healthcare utilization. Less than 40% of pregnant women in Pakistan get 4 or more prenatal checkups during their pregnancy. Out of all births that take place in Pakistan, only 1 in 2 are actually attended by what we call a stillbirth attendant. That is a person who is medically trained to help deliver a child. And of course, all this then adds to what we see in infant and child health. So if we look at infant mortality rates, UNICEF recently did a report called Save the Children. And according to that report, Pakistan has the worst infant mortality rate in the world. 1 in every 20 children die within the first 40 days of their birth. And mortality is like an extreme measure. What about children who survive? So roughly more than 25%, which means at least 1 in every 4 children in Pakistan are stunted, which means that their height for age measure is below 2 standard deviation than the average set by World Health Organization. So the motivation behind this paper was to kind of link the two, because we see a lot of correlation between women's education and women's health and then child's health. But we wanted to really disentangle the correlation and come up with how does education actually affect these outcomes. And so we look at this conditional cash transfer program that was introduced in the province of Punjab. What you see is the map of Punjab on your screens. The pink colored districts are the districts that actually received this conditional cash transfer program. So this program was introduced in all the districts that you see colored in pink, which we refer to as the treatment districts. And the blue ones are the ones that are controlled, which means the program was not in place in these districts. How was the control and treatment determined? It was determined based on what district literacy rates looked like according to the 1998 census of Pakistan. So districts that had literacy rates below 40% were identified to receive this cash transfer program, whereas districts above 40% were not going to receive this treatment. And so the program basically was introduced in 2004 in these districts, and it was initially introduced just for grades 6 to 8, which means that girls who attend grades 6 to 8 in these districts, if they maintain an attendance of 80%, they're going to receive 600 rupees per quarter. The idea was that this amount was going to cover costs of textbooks, uniforms, transport, any of these barriers that might be stopping girls from actually coming to school. In 2006, because of the success that was seen in these 2 years in enrollment rates for girls in secondary school in these districts, this program was expanded to grades 9 and 10 as well. And what our paper does is it kind of looks, and there is some research out there that looks at the short run impact at the school level and shows that girls' enrollment rates do go up. So what we try to do in our paper is we try to see what is the main aim of increasing secondary school achievement for girls? Is that met? And once that is met, what really is the impact in the long run when these girls are out of school, when they're in their adult life? How does it impact their decisions related to maternal health care? And what are the intergenerational impacts, or how does it affect the health and well-being of their children? So that's the main motivation of why we wanted to look at that and what the program actually does. It's a huge program. Its annual outreach into 2018 and at present it reaches out to 400,000 to 500,000 girls each year. They receive stipends under the program, and the cost is around about 14 million US dollars. What you see on screens right now is again the map of Punjab, but what you see now are district enrollment rates, which means what percent of girls are actually attending schools in these districts. And what you see on the left-hand side are the district enrollment rates in 2003, which means before the program was introduced. And what you see on the right are the district enrollment rates in 2018, much later, 14 years later than when the program was introduced. And what you see in both these graphs is that the light colored districts that you saw were the districts that had lower enrollment rates, which are our treatment districts, which we are targeting. And although they still in 2018 they still lag behind the better off districts or the control districts, we see a change. We see that enrollment rates are actually getting higher in 2018 compared to 2003 before the program started. So that's kind of the basic motivation and what the program is and what we wanted to see. Omar, would you like me to get into the results as well, or do you have any clarification questions before that?
No, thank you so much, Tareena. I think a great segue and context setting of what we're looking at in terms of the problem that was being solved through this conditional cash transfer program. And I think that's a great lead into what did you actually see? I mean, what do the results tell us? So we've seen enrollment increased, but really does this kind of an increase in enrollment, especially at a critical level of education at the secondary level, does that really signify what the importance of education in the life of females could be through your results? So please do go deeper into the results and explain to us in a less sort of academic way what these results mean and how they can be translated into sort of the significance of what the study tells us.
Right. So let me start by giving you overall what we see in terms of the basic aim of the program, which was to get girls to come to secondary schools and maybe complete secondary school as well. So we see that what you see in your screens is how we define years of exposure to the program. So out of all the years that girls are in school, how many years is this program in place? Of course, this program starts in 2004. So depending on which grade you were attending in 2004 determines how many years for you the program was in place. So for example, if you were born, for women born between 1980 and 88, they were already too old by 2004 to benefit from the program because they were past the secondary school age. So we use them as a comparison group because, they couldn't benefit from the program. They were already past that age. And then for women younger than that, depending on when they were born and which grade they were in 2004, we assigned to them the years of exposure to the program, or how many years the program was in place for them in their school going years. And what we find is that the program increases the probability of completing secondary schooling by 1.3% on average. And what you see here on your screens in the gray bars are the average rates of primary school and secondary school completion on the right and left respectively. And then we kind of break down our results by bands in terms of whether the program was in place for 1 to 5 years of your school going years, whether it was in place for up to 9 years, 6 to 9 years when you were school going. And then the most exposure could be that it was in place through entirety of your school experience, which is grades 1 through grade 10. And what we find is that it not only increases the likelihood of girls completing their secondary school, but actually if the program is in place in your school going years, it even motivates parents to send their girls to primary school, and it increases the primary school completion rate as well. We next move on to what you see on your screens now is what happens to the probability of women giving birth before the age of women getting married before the age of 16 and giving birth before the age of 17. And what we find is that it on average as a whole, it reduces the likelihood of early marriage or marriage before the age of 16 by 3.5%, and it reduces the likelihood of women giving birth before the age of 17 by about 3.8%. So we are seeing, as a result of the program, we are seeing reduction in both early marriage, and as a result, we're also seeing reduction in early childbirth, which of course, early childbirth also is one of the causes of high fertility rates in the country, as well as maternal deaths and poor maternal health as well. We also look at what happens to maternal healthcare utilization, because pre and postnatal checkups lack of pre and postnatal checkups are one of the primary reasons why we have such bad statistics in terms of maternal health and high maternal deaths in our country. And what you see in your graph, so the gray figures are what is on average, and what you see in the later colored bars on 1 to 5, 6 to 9, and 9 to 10 years is showing you how rates of pre and postnatal checkups are higher for women who actually benefited from the conditional cash transfer program. So much later in their adulthood, when they reach a point where they need pre and postnatal checkups, we see these women going for pre and postnatal checkups at a higher rate, which we expect to, of course, change into better better health for them. And then finally, we look at intergenerational impacts, and we look at what happens to the children of these girls. So these are girls are in school, they benefit from the cash transfer program, they reach adulthood, they have children. What is happening to the health and well-being of their children? And what we notice in this graph again is that compared to what the average rate of stunting is among children, for these women, if your mother has benefited from this conditional cash transfer program during their school years or has been exposed to the program, we see that child stunting rates are actually lower among those kids. And we also see lower probability of child death. So there's a question in the survey that asks, did you ever have a child that died? And we see that women who benefited from this program, were exposed to this program, we also see a lesser incidence of child mortality among them. So these are our main big findings, that this is a program that was aimed to increase secondary schooling for girls. But what we see is that the really downstream long run impacts in terms of their health, in terms of their children health and well-being, are also very positive. So when we think of these programs, I think the takeaway from our study is we should not be just looking at what is happening to girls' education, but we should also be seeing so many other problems that are being addressed indirectly through this program as well.
Thank you, Tareena. This seems like early cuts of a social transformation intervention that could fundamentally change how we live, operate, interact, and sort of address some of the very chronic and deep-rooted challenges in Pakistan. Farah, if I could turn to you and try to understand, how do you see the sort of scale of impact that we've seen through this program compared to other contexts in Pakistan, if such evidence is available, and more importantly, other low and middle income countries in Africa or East Asia or other contexts, and how do we compare in terms of the kind of impact and amplification we've seen through this cash transfer program in Pakistan versus other contexts, both within and outside Pakistan?
Thank you. That's an excellent question. So let me divide the answer into two parts. The first one is basically what happens in Pakistan, and then I'll try to compare it to other countries as well. So we're not the first people to look at what we should call spillover effects of education. So we're not the first to look at what happens other than just on the recipients of educations themselves. So there's a long piece of literature that's come from Tahir and Rabi and others who've looked at what happens when mothers are educated, right? So when mothers have any education, even if it's not secondary education, but if they have any education, there is evidence that their children spend more time at home studying as opposed to doing other activities, and they score better in schools. They've done another piece where they've looked at what happened to children who were impacted by the earthquake in 2010, which is kind of relevant also for what we're going through right now. Where there are massive learning losses. And what they kind of capture is that when you have massive learning losses, if your mothers are educated, again, not highly educated, just having basic primary or secondary education, then these learning losses are mitigated. So in the case of the 2010 earthquake, in their study, they actually see there are no learning losses when the mothers are educated, which is an exceptional kind of result. And then there's one work by Javeria Qureshi where she's saying, if sisters are educated, then their younger brothers also do better at school. So there's a lot of work that's looking at spillover effects. What we are doing is we are looking at more longer term effects. So we're not looking at what happens to a younger sibling. We're saying what happens to the woman when she gets married, and when she has to give birth, and similarly what happens to her children. So one thing is we see these different results. Our results are smaller than the results of those initial studies because they're looking at just the generation. They're not looking at intergenerational effects. They're looking at what happens in the same generation. So that's one thing. The other thing is that there have been studies done across the world which are looking at how to increase access to education. So in Zimbabwe, there was a change in compulsory schooling, and they found that when students have to now go to school, that increases their total overall years of education. It reduces likelihood of birth, early birth, similar to ours. But the results, again, are kind of larger because there the intervention is more explicit. So our intervention of the FSSP that we're looking at, we are assuming that people who are exposed to the program, if we knew that all of them were getting this level of exposure, this is the result we would see. Some of them may not be receiving that stipend. They may not be enrolled. Some of them may be enrolled. So what we're looking at is average effects. If you were to look at specifically at women who were receiving stipends, these effects might be larger. So one qualifier is that the effects we see over here, though they're meaningful, could be expected to be the lower bound of the actual effect. So the actual effects might actually be higher. And why do I say this? Again, guided by evidence from around the world. So there's a program in Ghana, which is kind of similar in the sense that they provide scholarships for secondary education. And what they find is that not only does secondary enrollment increase, tertiary enrollment also increase. And they similarly see decreases in the age of pregnancy, at the age of marriage. And so fertility goes down, health improves, and so on and so forth. And there are some studies that also show labor market outcomes improve. So there's definite evidence there. How the stipend program in Pakistan is kind of exceptional is that the cash transfer itself is not very large, right? So kind of differentiating it from the other countries around the world, the cash transfer is only small. So it's not sure if we got the chance to mention this earlier, but the cash transfer is about 600 rupees per quarter. It's not a lot. It was calibrated in a way that most of it should go towards the cost of transport or the cost of buying books or uniform, and there's not a lot left for other expenses of the household. And so this allows us to place the effects that we see over here more firmly in the effects of maternal education, as opposed to receiving a large cash inflow. So one of the things that we do differently over here in Punjab is the fact that the cash transfer is small. And despite having a small cash transfer, we see meaningful effects. Finally, let me just compare this to a very similar program in Bangladesh. So in Bangladesh, they also have a female secondary stipend program. It's slightly different. They have conditionality there as well, but they have additional conditionality. So in addition to the fact that in Pakistan, in Punjab, we say, you need to have attendance of about 80% over the last quarter. In Bangladesh, they say you also need to have scores equal to 40%. So that means not only are girls coming to school, they're studying. And the second thing they say is the girls cannot receive the stipend if they get married, right? So they're almost forcing people that in order to receive this cash stipend, you have to perform well in school, you have to show up in school, and you can't receive this after marriage either. And there the effects are again larger, right? But as I said earlier, this conditionality in Pakistan are smaller. The stipend program compared to Bangladesh is also smaller. And having said that, it's kind of exceptional that we see still such long-term effects, right? So just to give you a kind of an idea, in Bangladesh, the effect size that they see is roughly 5 times what we see for us in case of years of education. But as I said, the stipend is much larger. So if we were giving 600, they were actually giving, in equivalent terms, this was back in 2004, this was $10. In Bangladesh, they were giving twice that amount. And so they obviously saw much larger effects. So what we like to think of this generally is that looking at the evidence from around the world, the effects that we see might be smaller, but then the intervention that we're seeing is less explicit than those other interventions. And it doesn't target directly these spillover effects that the other interventions might be actually targeting.
Umar, can I just add to this, since Farah ended on a note on the size of the cash transfer? So our evaluation is kind of looking at, our evaluation stops at 2017, and specifically the women that we look at, of course, are not born in 17, they're 2017. They're born much earlier because we're looking at the long run impacts. But recently, this particular program has increased the amount of cash transfer by 4-fold. So the amount that they are now receiving, these girls are now receiving, is around 1,000 rupees per month, which is 4 times compared to what the program initially envisaged in 2004. So our evaluation focuses on the time period of the cash transfer that Farah is referring to. But now this amount has increased by 4-fold. The mechanism of transferring money has also changed. It's gone digital by mobile money, instead of actually, in earlier days, there used to be a postal order that was sent to the household. So going forward, I think if we evaluate this, some years down the lane, if anyone evaluates the long run impacts of this cash transfer, we might see bigger effects like other countries because the amount now is much larger.
Thank you, Tareena and Farah. And yes, I was going to come to how the program is actually operationalized and implemented, and the kind of aspects that also determine what kind of success the program achieves in terms of the sort of condition that needs to be met, which is girls staying in school. A question that sort of comes up once we try and contextualize these results with respect to other countries and regions is the unique context of Punjab. And what would be great to hear from you is, Punjab has had a very strong thrust of reforms at large around education, significant funding and assistance from development partners, and a continued sort of leadership on how to push for structural changes in education. For example, infrastructure is better than other provinces. That in itself has the potential to actually make the cash transfers more catalytic or effective. Similarly, access around roads and transport. So that general sort of package of reforms that's been developed and pushed in Punjab, how much of this do you think is complementary to the conditional cash transfer? And for example, if such a program were to be introduced in Balochistan, where the challenge of out-of-school children and girls is much more complex, or rural Sindh, how would this sort of vary across the provinces? What do you think? And please, Farah and Tareena, feel free to come in whenever you want to in this.
So should I start, and Tareena, then you can jump in? I just wanted to kind of, this is a good point, right? So infrastructure definitely matters in the sense that let's look at what the BISP program. So BISP also has, 2 different components. So the BISP itself is going to give unconditional cash transfers. Those could be used on education, for example, not necessary, but you get this cash inflow. Perhaps some of the families are going to start using it for educating both boys and girls. So what do we know from those evaluations? On unconditional transfers through BISP, there's no effect on education, right? So I'm just saying this because BISP is it's nationally provided, right? So it's not something that's just specific to Punjab, but it's everywhere. And it's somewhere where if any administrative infrastructure exists, then BISP would have that administrative infrastructure. And there we don't see an effect on education. There's no effect on grade promotion amongst girls. There's no effect on dropout rates and amongst girls. There's one recent study that is showing that there's some decrease in child labor in the short run, but in the long run or medium run, that goes away as well. So that's the unconditional cash transfer. The second thing is the Wasila Taaleem program. So there you have a conditional cash transfer. So here are children aged 5 to 12, so before the age group of the stipend program for primary school and some lower secondary children are going to receive some cash transfer somewhat equivalent, 750 rupees per quarter, if they have a minimum of 70% attendance rate. So kind of similar to this, but done across the country. Here we find that both the enrollment rates and the completion rates, etc., are higher. So for instance, the enrollment rate for both boys and girls are 10% higher for recipients of this program. But infrastructure, as you say, is very important. So if you look at the number of recipients of this program, Punjab and Sindh have like almost 500,000 per year who are recipients of this program. Balochistan has somewhere near to 30,000. So not many people, the first thing you need to do for this program is to register for the program. It's not clear how many people do that. And once they do that, what are the other administrative hurdles to actually receiving this stipend? Going to be much difficult there than in Punjab and Sindh. Khyber Pakhtunkhwa has about 250,000, so it's better than, it's somewhat in the middle. But definitely these are things that reflect different administrative capacities. And something like this in Punjab, as you say, there have been a lot of programs. So side by side, there is, there's a Punjab education sector reform, which has multiple programs going on. They're kind of orthogonal to what we're studying, but they do go on, and perhaps more than other provinces. And that might be aiding the kind of results we're seeing. And just before I hand it over to Tareena, what we do see, something that we have seen across different political regimes, is that different governments in all provinces have given this a bit of a priority. So they've, for whatever reason, they do always highlight that we need to get girls back into school or children back into school. So Sindh, for instance, if it doesn't have a stipend program, it does have a scholarship program. Khyber Pakhtunkhwa has a similar program as well. And earlier this year, Balochistan also announced, but now we also have the ESAS program that's going to be doing that. So I'm not sure how that works out. But there is some political buy-in in the idea of getting more girls to school or more children in general to school through cash transfers or through grants and stipends.
I think Farah covered the ground pretty well. I'll just add to this from my recent conversation. This program is funded by the World Bank. So I'll just add a little bit of my recent conversation with an official at World Bank, where we were talking about these effects we find and what does it mean in the larger context and everything. And one of the things he mentioned was that they did some sort of survey, not specifically on this program, but in general. And they say that a lot of people, even in Punjab, they felt were not aware of this program. Now, this program has been in Punjab since 2004 now. And the amount of cash stipend has just increased fourfold. But if in my point being that even if in Punjab, everyone is not aware of it, I think to Farah's point about why is there a stark difference between enrollment in Balochistan under that program compared to what we see in other provinces. So I think a little bit more, if we talk about how to take this to other provinces, I think we need to think about advertising or awareness that this particular program exists and the trust that money will actually be deposited through whatever means they want to use, whether it's a postal order or whether it's digital money. I think going forward, that's something we also need to think about if we want to see such programs in other provinces as well.
Thank you, Tareena and Farah. So I think in order to understand results like these and to be able to evaluate them, the most critical ingredient is data. And I would like to sort of shift the conversation a bit to the data regime in Pakistan. Now, MIX is a fairly consistent data set that is available on a regular basis, but a lot more could be done in terms of how education indicators are tracked beyond just enrollment and assessments. How do you think the data regime needs to evolve? What kind of challenges did you face in sourcing the data or collecting the data? And then some thoughts on how data should be the lifeline that's guiding a lot of these decisions in a much more proactive way than waiting for surveys and more sort of periodic, low frequency, high cost data. Rather than data that's really driving day-to-day decisions and strategic policy and administrative choices. Tareena, Farah, anyone?
Well, I mean, just to give you our perspective, MIX is a great data set. It's conducted in Punjab. It has a large sample size, so it allows us to do this kind of analysis, and it had very good quality data on the outcomes that we look at. But even within MIX, for example, Farah and I were really interested in looking at what happens to labor force participation and what happens to employment for these girls. That would have also allowed allowed us to see if the changes that we see downstream in children, how much of it is explained by increase in household income, because maybe these girls are now more likely to be working outside the home. And we just don't have that enough good quality data on employment and labor force participation, even in mix, to be able to look at that impact, which would have been very interesting. But unfortunately, we are constrained by what we have in the data. So I think you bring up a very good point in terms of how essential data is to conduct any kind of evaluation. And again, for our particular study, it kind of highlights how this particular program, any cost benefit analysis, for example, if you want to do on it, it should factor in the fact that all these outcomes are also being impacted, and you should not just be looking at what happens to enrollment rates or what happens to school completion rates for girls. And for that, of course, if you want to do this thorough kind of an analysis, you need much more data that's of much better quality as to look at all these different outcomes.
Agreed. Just to add to that, and maybe linking it to the previous question on working on the administrative capacity. So one of the things that we struggled with is, because we did want to do this kind of a cost-benefit analysis, is just figuring out which districts are receiving how much money, how many eligible girls are there per year, how many of those girls are actually receiving something, how many don't even know about it. And so, you could kind of infer by just looking at how many eligible by age, how many girls are there, and how many are actually receiving this in the district, which would show you what the gap is. And we just couldn't find that data. So it's difficult to get hold of. I'm sure it exists somewhere, but it's not something that's easily available. Similarly, I think there should be some administrative data that they would be collecting in terms of, is this being well targeted? So how do the districts kind of allocate this money to the recipients? Are they making sure that this money goes out? It's now digital, but we know there are barriers to digital finance as well, particularly in the kind of people who will be receiving this money. So if you've sent out some money, are they utilizing it? Are they taking it out? Are they using it for something, etc.? All of that should exist somewhere, even if it's some aggregate numbers, but it's ridiculously difficult to get hold of that. At least we weren't able to. And we've been working on this for a number of years, trying to figure out how to get these kind of cost benefits. And as Tareena said, just to find out if the labor market kind of situation improves. So we've looked at other data sets, but it's kind of remarkable that Mix does not ask about any incomes or occupation or any of those factors, which kind of stops us from doing a comprehensive analysis.
And I'll loop this back to Farah, what we were talking about earlier in terms of the evidence that exists for other regions and countries and contexts. Is the sort of lack of evidence or limited evidence around such interventions in other contexts, especially in Pakistan, outside Punjab, and even within Punjab, a function of this sort of limitation on data? And do you see more and more robust, more extensive, more current evidence in other contexts where data regimes are much stronger than Pakistan?
So I wouldn't give a very strong answer in that, because this is just on the basis of what we look at, what we can see in the papers and what we can see in terms of data being reported. It does seem that they have a lot more hold of just the administrative data on this would help. For example, if you were to look at, whether or not there are any delays in marriage, etc., for that you want to know who exactly is receiving this money and then track them through their lives and then kind of find out. And there are some settings where there's a lot of rich data on this. Some of them are just based on frequent data, but a lot of this is just keeping track of who's getting the money that you've sent out to people. It seems like that's not being done in this context. So in other contexts, in other countries, it seems there's more data. A lot of this, I should qualify this. Some of these papers have kind of gone ahead and done their own data collection, which is something would be similar to what we would be facing. And if so, we need more data, we'd have to just collect it ourselves. But it seems just from the rich analysis that they've done, even if it's in the short run or in the medium run, it seems that there's more data available there. So some of that would help. I think even in terms of just justifying whether or not this program has to go on or not, and especially given the fact that the government now, if it's going to bring it into the SRS program, so the SRS program targets different people. It's not really targeting everyone like the FSSP is. It's targeting just the people on a particular threshold of poverty line. Still, that administrative data should now come in, right? And that should be now followed, and people should be able to kind of figure out which family received this money, and link it to what was the attendance rate, what was over time, did they graduate from SRs, how did they graduate, did they get married, etc. So I'm hoping in the future some more data is going to come in from this new program. But at the moment, it seems like we're kind of behind other countries and other contexts.
Thank you. And coming to what can we actually use this study for in terms of a building block that points us towards other areas and sort of addressing challenges around those. So this was in particularly focused on secondary education for girls. You talked about quality and how learning and how that takes place at school level, in addition to enrollment, is a key area. Out of school children is again a chronic issue. How do you feel compared to the evidence that you've seen in other contexts, analysis of the program? How effective would such conditional cash transfers be for tackling some of these other challenges that again we've seen consistently in terms of poor outcomes in Pakistan? So out of school children, dropouts during COVID-19, improving the learning and quality of what comes out of spending all these years in the school. So thoughts on that would be really interesting in terms of how this program could inform branch outs and adaptations for other challenges and in contexts outside Punjab. Farah, please.
Okay.
No, go ahead, Tareena, and then I can add. I think you were going to, yeah.
Yeah, I think it's a great question. I don't have a great answer to it, unfortunately, but I do think that, cash transfers, like it depends on what the main issue at hand is. So if you look at primary school enrollment, issue is perhaps not out of school children anymore, because we do have high enrollment rates that we see there. COVID has of course changed that things, and maybe we can talk about that later in more detail. But I think there, if you're there, maybe like you said, the quality of education and what they're learning is perhaps becoming more important. But I mean, for girls especially, the secondary school enrollment rates are still so poor that the first effort, in my opinion, needs to be to get them into school. And once we kind of reach the point in terms of enrollment where we are for primary school, then maybe the focus should also switch towards what is the quality of education. And I'm not saying the quality of education is not important. My point being that there are always going to be limited funds, and you need to spend them in a way where you're getting the biggest bang for your buck, the biggest impact that you're getting. So I think in terms of getting girls into school, clearly this program is effective, which is why it's being expanded as well in terms of the amount, which is why it initially expanded from grade 6 to 8 to then later to 9 to 10. And we see all these downstream impacts there as well. But yeah, that's my take on how to target money at the moment.
Farah?
No, that's precisely right. I think we have multiple issues at hand, but from a resource constraint point of view, we need to kind of figure out where would this money be used most effectively. And so one of the questions that Tareena was kind of highlighting is, what should be the optimal amount of stipends? So should they be actually higher than that, or would something lower be sufficient to get just girls into school? We see massive learning losses because of the data that's coming out from COVID, we expect massive learning losses. And there, the related part of data is not necessarily about lack of access. It's basically for students who are near graduation, so one of the interesting things that perhaps Tareena knows about this more and can talk about later is that one of the recent work done by a group at World Bank, they were evaluating an SMS program, just to let people know that the education options are still available, etc., through SMS. And one of the survey questions they had were, how many students are out of school, and do the parents expect to send these kids back to school? And something interesting that you see in that data is that parents of primary school going children do expect they're going to send back their children as soon as school open. The real losses that come are basically students who've now left school in secondary school. There are a lot of students who are not going to go back. And the parents there are saying, look, they've learned what they needed to learn. They don't need to learn more. So that's just a different context. The stipend, the amount of stipend there, if there were stipends, would be different, because the kind of barrier you face there is different. And it's a kind of a mix of a quality of education versus just getting access. But for girls, interestingly, one of the biggest things that parents are concerned about is not having safe transport to school. And so for boys, the barriers may be different. For girls, it may be different. For girls, the stipend may be just more effective because it allows a group of parents to get together and kind of arrange transport, daily transport back and forth from school, etc. Right? So obviously, we need to kind of look at the different context, different barriers. For boys, it's different. For girls, it's different. And then take it from there. And again, tying it back to your earlier point, if we have data, we would be able to say more about what would be more effective, increasing stipends in general, or increasing stipends for a particular group of people, increasing information for people, just letting people know that there's some stipend available if they don't know it, etc. All of that is dependent on if we can kind of figure out what is the biggest barrier that people are facing in that context.
Great, thank you so much. We have a question from our viewers who are online, and I think before we move on to the concluding comments, it would be really interesting to bring this out. So Salman Naveed Khan, one of the key education experts in the country, he's connected, and he's interested to know if there was a causal link between district poverty and human development indicators and the CCT effectiveness. So is that something that came up in your research and results, and if you could respond to that?
I'm not sure I perfectly understand the question, but let me give some context, and then maybe Farah can also jump in. So just by the way that the districts were selected, or the way the program was rolled out, is that the districts that are receiving this cash transfer compared to districts in Punjab that are not, are of course districts with lower education statistics. They're also more economically backward compared to other districts in Punjab, and of course health statistics also are less desirable in these districts. But in terms of impact within the treated districts, does it differ by poverty and HDI? We kind of do various checks on our analysis, where we restrict, where we kind of take out from our estimation districts that are really different in terms of the treatment districts are selected as being below 40% literacy rate. We restrict our analysis to we drop out analysis that districts from our analysis that are like below 20 or 25% literacy rate, to really and check our estimations again if it is being driven by districts that are really poor, or on contrary, if what we see is being driven by districts that are relatively better off. And we don't find this. We find that our results remain robust to whether we include all districts or whether we exclude some that are really doing poorly on measures of poverty and HDI.
No, I don't think I have anything to add. I think that's exactly what we are able to say from our data. And just, maybe to mention that the results that Tareena mentioned earlier, we've done a battery of tests on just making sure that this is not driven by a single district. It's not driven by particular characteristics of districts, and they seem robust to that. And yes, then we don't see differential impacts by richer districts or poorer districts, or districts with a lot of, poor infrastructure, health infrastructure, et cetera, et cetera.
Thank you. And I think I would like to sort of bring this discussion to a kind of a point where such profound findings and such clear lines of impact, um, how should they inform education policy, both at the federal level, but because it's a devolved subject, even at the provincial level? Uh, the new national education policy has been in the works. It's going to be heavily centered on how COVID-19 creates a new reality of education in Pakistan. Each of the provinces have their own sector plans. As you said, expanding the CCT, both in terms of scale, districts, and the value of the stipend could have even higher impact on what we see in terms of these longer term outcomes improving. So there is a trade-off in terms of how this will be financed, who's going to finance it, how does limited allocation as an overall bucket and envelope get allocated to programs like these versus more traditional approaches like building schools or adding more teachers or furniture in classrooms. So, policy recommendations from Tareena and Farah for how this should feed into at least some part of thinking around how to shape the future of education in Pakistan, especially for girls who haven't had a fair chance at all of this for a very long time. Tareena and then Farah.
Yeah, I think even if we look at the new national education policy, I think thankfully getting girls in school and in particular secondary schooling has been always been. And more recently specifically it's always been a priority, which is really good because our study yes focuses around girls, but in the very first graph in which we look at enrollment rates between primary schooling and secondary schooling, we see a drop between primary and secondary enrollment rates for boys as well, not just for girls. It's just that for girls it's a lot more starker than what we see for boys. So I think the new education policy also kind of continues to emphasize that, but I do think that I don't have great suggestions, but I do think we need. I mean, we know that this is working. So yes, it should be in place. But eventually, we need to get to a place where we have a more creative solution. Because how long is a CCT program going to be sustainable from a budgetary point of view? And so, how long can we continue banking on something like this? So that I think we need to think more creatively beyond CCTs eventually as well.
I agree. I just want to add to that, again, learning from international experience. So one of the things that I didn't mention earlier about the very similar program in Bangladesh is that so in Pakistan, in the secondary education market, it's predominantly public schools. So most of the private schools in Pakistan are up to the primary level. In the secondary, most children in Pakistan are enrolled in the public system. In Balochistan, it's actually, in Bangladesh, it's different, right? So in Bangladesh, it's predominantly private, and then the government subsidizes it. And then that has some kind of additional implications for quality as well. So where Tareena was mentioning, how long can CCTs work on their own? Unless you have some sort of a build-up on infrastructure as well, whether it be extra teachers for schools or you encourage more schools to set up, even if it's in the private sphere, that is eventually going to be needed. Right? So we look at a matter of demand, but then the other side, which is supply, is also something that's very important. So you can't keep on increasing demand without increasing supply as well. And yes, the one reassuring thing in Pakistan's education policy in general, and the national education policy in particular, is that there has always been a priority on out-of-school children, especially in girls. So if you notice, all of the scholarships and stipends are larger for girls than for boys. And so there's this recognition then that there's one subset that requires this help more. But just to add to what is currently happening with SRs, for instance, in our analysis, if anything is clear, it's also this, that you can't just concentrate on the lowest income. Obviously, you can change stipends and you can cater different stipends for lower income households. But if the public school is the only option that even relatively middle income households have. And then providing some kind of stipend for them will also help, even if it's a lower amount. And at the moment, the stipend program provides this, but the SRS program doesn't. And that might be something that's worth thinking about in the future as well.
And just to add to, since Farah brought up this really good point about demand versus supply, that there are two sides to increasing schooling. One is, are households demanding schooling, which means, do they really want to send their daughters to school? And if they don't, maybe we can incentivize them through the CCT and cover up whatever costs we think might be hindering them. The other side is supply, right? Now, again, if you look at, there's really good education data that kind of tracks, at least in 2006, the number of schools in each village in Pakistan and when they opened and everything. And so if you look at those, you're almost, primary schooling is almost everywhere. You're much more likely to have a girls' primary school in your village, but then oftentimes the drop that you see in secondary enrollment is because, okay, but now our daughter has to go to secondary school. Our village doesn't have a secondary school. She has to go to a neighboring village. Who is going to take her? She's at an age where she can't, walk alone or go alone. We don't have the money for transport and so on and so forth. So of course, then the supply side comes in. Maybe they want to send their daughter to school, but they can't because there's no village, and then there's no school in their village, and then all these factors come in that hinder girls going to secondary school. So I think, we need to keep in mind both the demand side, but as well as what is happening on the supply side in terms of building schools as well.
Absolutely, and I think there's a very integral component of how behaviors would change over time as a combination of a lot of these factors, and not just a cash transfer that goes through. Just taking on what your findings and analysis of this finds out, improving awareness around these programs, the value of the transfer itself, the scale, the implementation, and how integrated all of this is to education, and how it's perceived and conceived and eventually delivered. Thank you so much, Dr. Tareena and Dr. Farah, for your time and having this great conversation with us. Fascinating results. And look forward to more research and analysis coming out from you that we can then build on and learn from. Thank you so much for being here and taking the time.
Thank you very much for having us.
Thank you. Thanks for having us.
Thank you so much.